can see. A little bit more detail here about CMSP eligibility. Poverty limit, you need to be in between not eligible for Medi-Cal, so deemed ineligible for Medi-Cal or other publicly funded coverage, and enrollment terms are 6 months. Again, your benefits, and then CMSP contract providers in Sutter County, you can see are Ampla Health, Harmony Health, Sutter Butte Imaging, and Peachtree Health in Yuba City and Live Oak. Currently, our CMSP population is under 1,000 members. Back in the day, back pre-ACA, when I started in 2006, we were about 60,000 members. And we were up to about 80 to 90,000 members. So the board got together and they said, you know, what are we missing? What in our counties who is falling out? Who needs health care still in our counties? And Path to Health was formed and started in 2019. And again, this is where you go into one of your community health centers. Usually you're able to get on right away if you're on a restricted scope Medi-Cal aid code. That's how you get on to Path to Health. Over 15,000 members, but you may have heard May 1st, 2022, over age 50 went to Medi-Cal. So that dropped to about 11,500 population. Connect Care is our newest program. We expect it to be as big or bigger than Path to Health. It's, again, same thing. You go into one of our health centers to get enrolled. And income's different, your documentation status, but it's all primary care. Here are just a little look at our participating enrollment clinics. So this is Path to Health and Connect to Care, different community health centers where you can get enrolled into Path to Health and Connect to Care. Those are our enrollment centers. So if somebody in a neighboring county, they could get, and maybe they don't have where they get other Connect to Care in their county, they can get signed up in any county, any location, any place, and then they can get services at any of our contractor providers in our 35 counties. I'm going to turn it over to Megan to talk about our grant programs.
Thank you. Hey, good afternoon. Thank you for having us. So as Carrie mentioned, I'm going to be going over our grant programs. The first one is our Local Indigent Care Needs Program. This program, the board has allocated $50 million to be released for the Lichen grants. There are planning grants and implementation grants, and the primary focus areas are local care management, continuity of care, and enabling services and disease management. Approximately 22 planning grants and 18 implementation grants. Sutter County Department of Health and Human Services was awarded a planning grant for $50,000. The grant funding was used to identify barriers to care by previously incarcerated or unhoused individuals. And we are currently in the process of recommending approval for 9 more implementation grants. On that list is Sutter County HHS. They have submitted a proposal for $1.5 million, and the recommendation for approval will be at our board meeting this Thursday. Next, we have our COVID-19 Emergency Response Grant, or SERG. When the pandemic hit, CMSP released the SERG $9.6 million, 31 of the 35 CMSP counties. Primary focus areas included providing PPE, supportive quarantine services, and engaged service providers needed for emergency response. Sutter County HHS received a SERG grant for approximately $265,000. The funds were used to provide supportive quarantine services to 84 individuals, as well as public information and outreach to the Latino community. Our next grant is our Health Systems Development Grant Program, or HSG. One of our primary focus areas of this grant is to expand access to care. To date, we have 23 nonprofit organizations that have $6.8 million. Sutter County HHS has received an HSG grant totaling $300,000. Funds are being used to improve the overall healthcare delivery system, and specific projects include increased CMSP dental providers, linking individuals to needed services, and conducting diabetes empowerment and education classes. Next, we have our Specialty Care Access Grant. This grant provided funds to Operation Access to expand specialty care for low-income uninsured adults by arranging elective outpatient procedures through donated care. This is a 5-year grant totaling $5.7 million. This grant partners with societies. 2 Sutter County residents were served in 2021. Lastly, I have the Healthcare Workforce Development. Under this, we have 2 programs, the Cmsp Loan Repayment Program and the Allied Healthcare Loan Repayment Program. These programs work to expand and support healthcare workforce by providing educational debt relief in exchange for service at CMSP provider locations. To date, 10 providers in Sutter County have received awards totaling approximately $200,000. Awarded professionals include chiropractor, medical assistant, nurse practitioner, and physician assistants. And I'd like to point out here that we have an open enrollment program for our CMSP program. You can reach out to us for that.
All right, I'm going to talk, I just have one slide about financing. You might want to wonder how CMSP is financed. So I have 2 points here. There's Pre-Affordable Care Act and Post-Affordable Care Act. So Pre-Affordable Care Act, there was county realignment, there was CMSP realignment, and county participation fees. Post-Affordable Care Act, county realignment was directed to the state, and that county realignment was capped at the pre-ACA CMSP amount established in 1983. Significantly reduced CMSP realignment through 1819, and then our realignment was postponed in 2018 until our reserves are reduced down to 2 years of operating costs. Also, county participation fees have been waived every year since ACA. Resources. Staff, myself, Megan, and our program director are great resources if you have any questions. And here I have on the side of this slide some of our marketing materials you may or may not have seen in your counties or in social media. We also have 3 websites. We have our main website, cmspcounties.org. We have a Path to Health website, a Connect to Care website, and then we have a great page to go to just to find there's a great table here, and it can direct you to any of the programs that somebody might be eligible for in your county. It's called careandreach.org. And that is our presentation. We're ready for some questions.
Bring it back to the board for questions. I don't have it. With that being said, thank you very much. I hope that we try for a little more next year, but looks like a lot of help, looking at everything that Sutter County's getting out of it. Very cool, and it's needed. Thank you.
Mm-hmm. You're welcome.
Yuba-Sutter.live's local government live streams are presented by Plumas Lake Self-Storage in Plumas Lake, where lifelong local residents are helping other residents keep things safe, providing indoor storage units, outdoor RV and vehicle parking, moving supplies, and Penske truck rentals. Details at plumaslakeselfstorage.com.